Today we'll be promoting heart health. We will be learning about hyperlipidemia, which means that you have high cholesterol and high triglycerides, or both. You may have been told that you have hyperlipidemia or high cholesterol. Of course, hyperlipidemia sounds like a mouthful. Hyperlipidemia represents high level of cholesterol, high levels of triglycerides, or both. Cholesterol, it's fat that builds up in your blood. Of course, you may not feel sick or feel anything at all. It's silent. There are good and bad cholesterol. HDL, or high density lipoprotein, is known as the good cholesterol. LDL, low density lipoprotein, is known as your bad cholesterol. Of course, you need both of them in your system to function well. High density lipoprotein is known as the good cholesterol. It helps to clean out some of the bad cholesterol. It opens up your artery, and it also helps in removing excess cholesterol from cells to the liver. LDL, low density lipoprotein. This is cholesterol that is considered bad cholesterol. It should be low, and it helps to it collects in the wall of the artery. It narrows blood flow and makes it hard for blood to pass through. You might be wondering, what caused this? Well, age. If you have family history, what you eat, if you eat food that is high in lots of saturated fat, if you're overweight, if you have diabetes, those are some of the causes that can lead to hyperlipidemia. Age, 20 years old and above, yes, hyperlipidemia can affect you, especially if you have a sedentary lifestyle. And mostly ages 45 to 65 years old. Middle-aged adults. Hyperlipidemia affects middle-aged adults more. What causes hyperlipidemia? Excess alcohol, smoking, lack of exercise, sedentary lifestyle, in other words, and some medications. What are the risk factors of hyperlipidemia? Heart attack, coronary artery disease, stroke, dementia, erectile dysfunction in men. The National Institute recommends a fasting lipoprotein blood test for 20 years and older. Every 5 years, this measures the total amount of HDL, LDL, triglycerides, and cholesterol. For those who have high cholesterol, an annual physical with blood work that checks your cholesterol is highly recommended, or as your doctor prescribes. Cholesterol levels should measure 200 milligrams or less. HDL, meaning your good cholesterol, should be 60 milligrams or greater. Your low density cholesterol should be 100 milligrams or less. Your triglycerides should be 150 milligrams or less. Having high cholesterol is manageable. You can maintain a balanced diet that is eating lots of fruits and vegetables, diet that is high in whole grains, and avoid saturated foods. Unhealthy food includes food with trans fat, meat, dairy product, processed food, and so on. Other ways to manage your high cholesterol is by not smoking, regular exercise that can be done with walking, running, jogging, just doing things, everyday life activity, moving about, being active, and managing your weight, watching what you eat. Healthy food that contains unsaturated fat includes fish, carrots, vegetables, grapes, the whole line of vegetables and fruits. If diet and exercise is not enough or is not effective for cholesterol, then your doctor will have to prescribe medication. Mostly prescribed are the statin medication, which works on LDL and HDL cholesterol. I hope this video was informative. Thanks for listening.